Good morning, and thank you for joining us this morning. My name is Rachel Leventhal-Weiner, and I'm the Office of Early Childhood's Chief Research and Planning Officer. This morning, our agency is presenting a webinar on updated COVID health and safety guidance. We're joined this morning by Commissioner Bye, as well as Dr. Lynn Sosa. We are happy that we can offer closed captioning in 4 languages this morning. To access closed captioning, look for the CC button in the bottom right corner of your screen. That would allow you to set the settings to access the languages of your choice. During the course of the webinar, you'll have an opportunity to offer questions to the agency that we will answer in a moderated question and answer after the presentation. Please know that many of your questions may be answered by Commissioner Bye's remarks or by Dr. Sosa's remarks. We will do our best to answer as many questions as possible and have left ample time to address your concerns. Thank you so much again for joining us. And with that, Commissioner Bye.
Thank you, Rachel, and thank you all for joining us and everything you're doing to keep children and families and your staffs safe and healthy at a time that is a big challenge. We know that things right now are as hot as they've ever been, and that there is some spread in childcare programs, and families are stressed and programs are stressed. What we wanted to accomplish today was to bring you the most updated guidance on our memos and how to stay safe as best as possible. And I'm really grateful to Dr. Sosa for joining us from DPH, who's been working with us throughout the pandemic. So we did release Memo 37 and 45 last week, and you all sent a lot of questions and asked for more clarification, et cetera. And we have been working since with DPH, the State Department of Ed, and the OEC team to try to provide as much clarity as we can at a time of a pandemic. But we do believe our updated guidance makes things a little more clear and makes reporting a little easier. Today, what we're going to try to accomplish is I will give you an update on just the overall Connecticut data that DPH provides, and Dr. Sosa may have some follow-up comments about that. Things you can do as adults and staff to mitigate the spread. Just give you an update on the mask and test distribution. We'll go through the changes in the memos related to COVID-19 and just some reminders about best practices. I just love these pictures of these 2 little babies too this morning when I was saying, I got to add some kids to this webinar. You all watch the news and you're all experiencing firsthand that the Omicron virus is very contagious. We have more cases now in Connecticut than at any time, and we know the same, probably 2 primary things you can do are vaccines and boosters. So get your vaccine and booster up to as current as it can be, and mask wearing. So we know, this is a quote from Dr. Jutani, that vaccination continues to be the best defense against severe illness. And I'm going to have some data to show you. But at the end of December, the data in Connecticut was you're 10 times more likely to be hospitalized if you're not vaccinated, and 15 times more likely to die of coronavirus. So the data is so clear. I know we're living in a difficult time when people get their news from just different sources. This isn't news. This is actual data about what's happening in Connecticut. So getting vaccinated, helping to encourage your staff to get vaccinated, which I've talked to many of you. You are trying to do that, and you still have some that are hesitant. So we have other tools too that we'll talk about today, but I don't want to not stress vaccines. This is data that was released this week about differences in outcomes. So in Connecticut, most people are vaccinated, which has been very helpful. This is just showing in New York City and Seattle, which Connecticut follows the same pattern. This was just available. Hospitalizations and in Seattle and New York City for vaccinated versus unvaccinated. Because right now what we're dealing with is those people who are vaccine hesitant are saying, well, you can get it anyway, even if you're vaccinated. Well, you may get it because it's more contagious, but the outcomes are very different. And we're responsible for children and their families in our care. And so staff being vaccinated means they're less likely to spread it, less likely to get the children sick, less likely to get the family sick. And same, if your families get vaccinated, and that really helps. And I think one of the big differences in childcare is that children under 5 cannot be vaccinated. So you all are really on the front lines in one of the more challenging health situations because of that. And that does impact our memos that we're going to talk about today. This is simply the actual Connecticut data about the increase in cases. I want you to take note. You remember back here in April when everything shut down, and then we had a lull, and then last winter we had another spike. You can see that the cases were not nearly as high, but because we have vaccination, the outcomes are really different if you look at deaths. So last April, when everything shut down, there were a whole lot of people who were dying from COVID. And if you look now, even with way more cases, the number of deaths is significantly lower. So we know that that's from vaccination, and Omicron seems to not get in the lungs as much. Now, this is a little hard for you all to read, I know, on your computer. The very first bar is November 13th. The very last bar is January 15th. And this data on January 15th is not complete, but these are the cases that are reported in childcare. So green represents the children and blue represents the staff. And what DPH does is, as they finalize the data, that will change. Also, I know right now, and you're going to hear about a new reporting mechanism, that DPH is under siege. They're getting a lot of phone calls and trying to manage those. So we're going to go to a forum to make that easier for them to track. Dr. Sosa, did you want to add anything about this slide?
No, I just want to thank everybody for all of their work in reporting these cases. It's still important that we do that, but we think we can do that in a way that is less burdensome both for you and for us. So we'll be talking more about that in a minute.
Yeah. The other thing, just to, we talk a lot about what you can do at your program, but this is important to stress to your staff who are going out in the world when they're not at work, or to you going out in the world when you're not at work. These are ways that everyone can help reduce the spread by wearing a mask when you're in public spaces. I know in my community, if I walk into a grocery store, 90% of people are masked, but I know I went 2 towns over to a grocery store and it was less than 50%. So I know that across the state, there are different amounts of compliance, but for people who have the responsibility of working with children who can't be vaccinated yet, and their families, because if the children get sick, they can bring it home. And certainly there are plenty of families in Connecticut that have immunocompromised family members in the house who, even if they are vaccinated, getting the disease would be really difficult. It's not really a time to have big private gatherings. Keep your gatherings small. Get tested if you've been asked to quarantine. If you have any symptoms at all, cold, I will say, just from our staff and hearing from programs, a cold, a sore throat, a headache seems to be how people are describing Omicron. Our son just recovered this week after being able to avoid it for a very long time. He got a case and was super tired, sore throat, headache, and there are some different symptoms for different people, but it's definitely out there, and use your tests, and really think about travel cautiously, following state, local, and even federal guidance. So I just think these kinds of things are important to share with your staff. I know a lot of them are like 25 years old and they want to go out with their friends, but important to remind them to mask indoors if they're going out, etc. This is the Connecticut data from the 12th this week. Our positivity rate was still above 20%. It seems to be inching downward a little bit, but I'll let Dr. Sosa speak to that. Then I just wanted to go over how it went with mask and test distribution. We know that Tuesday in New Britain was challenging because there were so many people picking up tests there, but we were able to get many tests out, working with the National Guard and Department of Emergency Management and Homeland Security. That was really important. And I heard from providers on Saturday at the pickups just how important those early tests were to try to keep staff out who tested positive and keep the programs open. It's certainly not perfect. We know the programs are dealing with a lot of challenges around quarantine. We're hearing from families, we're hearing from programs about how difficult this time is, but hopefully the tests and the masks help a bit. We distributed more than 100,000 masks and almost 100,000 tests for programs that picked up. Now, some people were not able to make it to either of those dates, which we certainly understand. And we will be announcing very soon more regional pickup dates for those of you that couldn't. I think it's important to say that every center in the state has an allocation. We have an enormous spreadsheet. So we're holding your allocation, and there will be at least 2 more regional pickups to help you. Or if it's one, it will be a very long day to make sure we make those accessible for those of you who couldn't make that. The way we calculated it, because there were big differences, I mean, there were a lot of questions about this, and we took whatever your licensed capacity is as a center, and we assigned 1 test per licensed capacity. That's not per child, it's just a way that we thought bigger, more. And then we added 20% to account for staff, thinking that, you know, at a 1 to 10 ratio, that would give every staff member 2. And again, just like with the stabilization funds, benefit of the doubt to the provider. We didn't ask you your enrollment, we used your license capacity. We know you have a bigger license capacity than kids. And same with staff, we just assumed. So it doesn't mean you're giving every family a test. It means you have the test for people that are symptomatic so that they can test to be safe. Or if you had a big exposure in a classroom, to help families, give families a test to give to the children. And then for family childcare homes, we assign 10 per family childcare home. The average family childcare home has between 4 and 6 children, but again, benefit of the doubt, we went to 10 just to make sure there were enough for staff and families. And on the masks, we distributed them in 20s or 50s, depending on what day you picked up. We just rounded up. So if you qualified for 14 masks, you got 20. If you qualified for 25 masks on Saturday, you got 50. So if you got 12, you got 50 on Saturday because they were in boxes of 50. So hopefully you found that helpful. Governor Lamont, it was really important to him to consider childcare as he was considering schools. We found that was really something he understood, that childcare is on the front lines. The kids can't even necessarily be vaccinated, and we need to get tests out. All the tests come complete with instructions in English and Spanish. And just reiterating that the staff are not to be administering tests to children. It's meant to give to the families to administer to the children. I wanted to just share this because what we discovered, even as part of helping the state, I couldn't express to you how difficult it was to get those tests and to procure them, to get them delivered to Connecticut, to get them out, because there's big demand for these tests now across the country. We're competing with other states, other countries, really, and Governor Lamont just made it a priority to get them. And so people worked very hard to get those. But I don't know how many of you know about Connecticut Shares, and hopefully most of you do. But Connecticut Shares, you can Google that. It's a website where you can do group purchasing and get discounts. Also, we've launched a job board in collaboration with Connecticut AEYC, where you can post your jobs for free. And so it's really worth joining CT Shares. And I mention this because if they do have self-test kits available, if you need to order more, I just wanted to let you know of a source because it's very difficult to source them. And we worked with them over the pandemic and connected them with the state in case they could supply the state with more tests and masks. So at this point, the plan was to get 200,000 tests and masks out. And then hopefully we'll see Omicron come down and the availability of tests go up. But the governor felt like during this crunch time, he wanted to get some out to schools and programs. Okay, here's where we get to the meat of the matter. And I'm just going to ask my team, whether Deb Johnson or Deb Fliss or Lynn, to make sure as I go through this that I'm not missing anything, and just chime in if I am. So Memo 37 we sent out about a week and a half ago, updated, and then got a lot of feedback from you all that it needed to be clarified. And Dr. Sosa and Dr. Jutani and the Tom St. Louis at DPH worked with us and with SDE at the same time, because we're trying to align whenever we can with the State Department of Ed. So this does take time. I wish we could have turned around the next day and say yes, but we had to get to new language and then get it approved up the chain to make sure the epidemiologists and doctors looked at it, and it was in line with meeting health and safety standards. The two things are really important differences between the State Department of Ed and the Office of Early Childhood. The State Department of Ed has oversight mostly over children 5 and over who can be vaccinated. And if you go to the CDC guidance, that's one of the key questions in terms of isolation and quarantine. So that's different. And also children under 5 may not be able to reliably wear a mask, and children under 3 do not wear masks. So now you've got two, I talked at the beginning, vaccination and masks being two of our very important mitigation strategies. So we've updated it. We still want to stress that your local health departments can continue to be a resource because cases are individual. But now we have changed the reporting, the way you report cases. The memo will contain a chart about exclusion, and also it will include a link to a reporting form. So rather than have to pick up the phone and call DPH to say, I have a case, you're going to fill out this form weekly, and I'm going to have Dr. Sosa talk about that. I will say I've received many emails from you all and from families very upset about the program closures and the 5 days or 10 days. So we hope that this guidance that we're giving you today can help you provide clarity to families about the quarantine rules, and also that you're getting this direction from the Department of Public Health and the Office of Early Childhood. I want to point out one other thing before I turn it over to Dr. Sosa. Whenever it's so hard to keep track of all the memos, like I think this is 37, we have 45 that I'm going to talk about today, and then we update them. So so hard to keep track of all that. So just know that every time we revise a memo, we basically put the changes in a box at the top so that you'll know what those changes are in a very quick way. And then in the memo, I just talked to you about there being a guidance chart. I'm not going to walk you through this at this moment. It's really meant to show you, you have this chart from the prior version, but this chart has been updated to describe the differences for children under 3 need 10-day quarantine because they can't mask reliably, but children who can mask reliably and need a 5-day window of quarantine and isolation. And I'll have Dr. Sosa speak about that, but that's outlined in this new chart that's in the memo. Let me just go over what's changed. I talked about your report on a form, 10 days of quarantine for younger children who can't reliably mask. And then this is where the judgment comes in. If you determine that 3 to 5-year-olds in a classroom can reliably wear a mask and consistently wear a mask, then you can make a decision about a 5-day or a 10-day. If you say, no, they can't, that room, half the kids can't keep their masks on, I've got to, in that room, it's got to be 10 days, that's your judgment. But if they reliably are wearing masks, it's 5 days. And this is just a copy of the form. I'm going to stop sharing my screen now, and Dr. Sosa is going to take it over and talk about the reporting form. And I just want to remind you, there'll be plenty plenty of time for questions. I'm going over this quickly to save time for questions. Okay, Dr. Sosa, take it away.
Sure. So I think just to touch briefly on the guidance. So as Commissioner Bye had said, the updated guidance from CDC is really predicated on the ability of the person that we're talking about being able to wear a mask. So if that person can't wear a mask, we are really not in a position to use those shorter quarantine or isolation periods. And so that is what we're trying to make clear in this guidance. So it's those younger children, unfortunately, we really still have to go with those 10 days. If the children are older and can wear masks, then we can use those shorter periods because they're able for that additional 6 to 10 days wear the mask, which is really, really important. So that's really what we're trying to give that flexibility here, but also understand that you all know your children the best. And so you're going to know the classroom that has the kids that are really, really good at wearing their mask and those that might not be as good about wearing masks. So trying to kind of, especially maybe if it's a younger, more of a 3-year-old classroom than a 5-year-old classroom. So trying to give the flexibility for you all to be able to apply those periods in the situation that you know best. And I'm sure there'll be more questions about that. So what I want to go over now is just how we are changing reporting, how we're changing reporting. Because I know that you all, I personally take these phone calls from you when I'm on call on evenings and weekends. And so I've definitely talked to many of you, and I certainly have enjoyed those conversations. But I know sometimes, especially now, since we've been all doing this for 2 years, a lot of times it's just calling to report the case and just trying to get that job done. And certainly with what's been going on over the last several weeks, that's been really, really hard to do, not just for you, but for us, as well as local health departments. We want to be sure that we are capturing these cases, but we don't need to do that at the individual level anymore. And so what we want to do is kind of move to a similar model to what we've had schools do for quite a while now. So schools have been reporting to a portal where they tell us the total number of students and staff in their school that have tested positive. And that's basically what we're asking for you all to do, just in a slightly different location. So I thought the easiest way to do this was to actually show you the form that we're asking you to report, but also kind of give a scenario for how we're envisioning this reporting to work. So the first thing I want to do is just pull up the first thing. Here we go. All right. Can you guys see my calendar? I just need someone to say yes because I can't see it. Yes. Okay, thank you. Awesome. Okay, so we're looking at the month of January. Okay, so the first thing that is different about this reporting is that we're going to be looking for reporting for an entire week. And so what we consider a week is Sunday to Saturday, right? That's pretty classic, I think, about what people, when they think about a week, the week begins on Sunday and the week ends on Saturday, okay? So on this next slide, I've highlighted the current week that we're in, okay? So we're looking at all of the cases that are being reported to you from your families in a given week. So if they call you on Sunday, then that would be included in that week. If they call you on Friday, it's included in that week, okay? So now let's put some numbers in there, okay? And I just kind of put in random numbers. So let's say that you are a provider and these numbers represent the number of cases that were reported to you on those days. So today's the 14th, okay? And so we're saying you got one case on on Monday, 2 cases on Tuesday, 1 case on Thursday, and then I'm seeing into the future and 3 cases on Saturday. So the way our system works is that we report all of our data. I don't know if this is going to work, but we actually report all of our data on Thursdays. So I just circled the 20th, which would be our next Thursday report. That's when we report the daycare data as well as school data and kind of those big groups of data. So to be able to get it into our system, we're going to want it by Tuesday, which is the 18th. So what we're hoping to happen is that we can get an entire week's of information reported either on Monday or Tuesday of the following week. So for all of these data, for everything that's in yellow here, we would want that to be reported by the 18th into this new system, okay? But I know it can get confusing sometimes. So right now, for what's in yellow is we have 1, 2, so that's 3, 4, 5, 6, 7. So that would be 7 cases, okay? And again, the idea is to report it by Tuesday of the following week. But someone might call you on Monday and say, hey, I tested positive and I'm calling you today. We don't want the data from the 17th in with this yellow data. Okay, we want to try to keep those weeks separate to the best of our ability. We know that there's going to be some overlap, but the whole point here is that we don't want to do too much duplicate information. Okay, so now I'm going to show you kind of what this would look like in the form that we have now. So we have 7 cases for this current highlighted week. So now we're going to go, I'm going to actually unshare this screen and go to the actual form that has been created for this. Actually, I think. Let's see. Sorry, I'm doing this the wrong way. Okay, can you see the case reporting screen?
Yes, we can.
Yes. Okay, great. So this is actually what the form looks like. This is what you all will see when you go to the link that I know has been provided in here. And just to read the directions at the top, the idea is to report by close of business Tuesday all the positive cases among your enrolled children and staff reported to you during the previous Sunday to Saturday. So that in our example, that highlighted period. Okay, and this is by any test. Okay, so you don't have to worry about whether it was a home test or a PCR test or whatever. If someone calls you and says I tested positive, those we want you to tell us about those cases. Okay, and so we also have in here if there's older data that you forgot to report. I will talk about that in a minute. But so this is basically how this would work. So you're gonna click on your whatever license type you are, and I think most of you are going to be child care centers. You're going to enter your license number. You're going to enter your program name. I'm just putting in random things here just to be able to show this to everybody. And then you're going to enter your town. And I'm in East Lyme, so I'm going to put in East Lyme. Okay. And then here you're going to put in the total number of enrolled children. So I said that last week there were 7 total cases. So I'm just going to make up a number and say 4 of those were children and 3 of those were staff. You're going to put 4 and 3 and press submit. And if you see this thank you kind of response, you know that your response went through. Okay, so it's actually very, very simple in terms of being able to do that. The key is only doing that reporting only one time. So that's why it's really important to wait for that week to be done and putting in that information one time so then you know that you reported it and we don't have to worry about whether, you know, we're double counting because we have more than one report from a center in a given time period. Now, let's pretend and say that in a couple, you know, it's going to take some time for everybody to get used to this, and we know that. So let's say in a couple of weeks, you start reporting and you're like, wait, I realized I forgot to report for a given week. Okay, the way that we want you to deal with that, and I'm going to see if I can go back here. Not sure if I can. Is we actually want you to email us. I'm actually just going to get out of here. We want you to email us, and there's an email address at the top there to say, hey, I forgot to report for this week. So say you forgot to report for the current week we're in, you can say, I forgot to report for the week starting January 9th. These are how many cases I had among among enrolled children, how many cases I had among staff. And then we'll be able to put that into our system later. So I know that's a lot of information, but really the goal here is that we're just trying to take the total number of children, total number of staff in a given week. You only need to report it once. That's really important. If you forget to report data, that's okay. We will take that information via email and make sure that it gets into our system. So I think I'm going to stop there because I know there's we're already at 11. I know there's going to be lots of questions.
Thanks, Lynn. Just checking with my team that my screen is back up and working. And it
Yes.
says Memo 45?
It does.
Okay. There are also some changes to Memo 45 about vaccine requirements because there have been some temporary changes that will be coming to an end starting next week. There was a temporary allowance to use home tests for those who needed to, who did not get vaccine, who need to be tested. And I just want to be clear, this was not the purpose of the tests that came to programs, because staff who are choosing not to get vaccinated or who are using the testing instead that's intended to be their job to get tested, and we're not supplying. The vaccines are meant for children and families and staff who are symptomatic. So what I'm encouraging, so January 7th, this ends. So we will accept it through the week of January 17th, which is next week. But the week after, they will need a PCR test. So we know that there are backups to get a PCR test. But I know today I went on to see if I could schedule one at my healthcare provider. I could schedule one a week out. So just encourage those staff who need a PCR test because they are not vaccinated, that they should schedule that now or very soon to meet that January 17th deadline. Also, just a quick reminder to continue the basic public health practices of hand washing, screening. One of the most important things is just to tell your staff, do not come in if you feel like you have a cold, if you feel sick. And the same with parents. Do not bring a child unless they have been tested if they have a cold. And I know that's difficult. Also, ventilation continues to be important. This is all on our website. And get outside as much as you can. Be outside with the kids. Be outside with the kids. And we do have 2 webinars on our website about ideas and ways to make sure you can get outside. So we do have resources for that. And then just a thank you. And we want to save time for questions. I saw this question when I was getting this quote from Greta. I really love being human, but some days I really wish I could be a fairy. I think we're all feeling like that right now. We'd like a little escape from these difficult times and so many decisions and very often not clear answers. So, but I know there are some questions that we can give clear answers to, and I always feel good when I have Dr. Sosa with me. Rachel, I'm going to turn it back to you. I don't know who is going to be asking us the questions.
And that will be me. So I want to thank all the participants for all of your questions. Our colleagues have been organizing them and getting them ready. So I think that maybe we should start. You've answered many of these already in some of your remarks, but let's review. For the memos, there have been many questions about quarantine guidance. Some of the questions are about the differences between public school policies and policies on childcare. And I think we want to reiterate that all individuals should be consulting their healthcare practitioners or professionals. But can you comment again on the difference between the quarantine guidance for public school settings versus childcare settings?
Yeah, Dr. Sosa, do you mind taking that one? I think I've spoken to it, but maybe you can reemphasize or make it more clear.
Well, yeah. So I mean, so I know there have been lots of questions about, schools not having to contact trace and what does that mean? So first, I want to be clear that we have not said don't contact trace. What we have said is that schools need to use their resources to the best of their ability. I will also say that schools are very different settings than childcare settings, right? So many childcare settings have students that not only are not vaccinated, but can't wear masks. There is also no distancing. And I will say that having been doing this for the last couple of years, we have documented many, many outbreaks related to exposures in these settings. And, that's just the reality of these settings and the types of interactions that that the children are having. And while I understand that, especially for older children, it seems like it's more similar to school, I'm not sure that it always is. And so I think it's important to kind of really look at that at that distinction, that really most of the settings that we're looking at here are very different from the school settings. I know that there's potentially some overlap when we look at pre-K. However, I will say that while the school guidance applies to pre-K that are within school settings, I am aware of many pre-K settings that are using more stringent criteria for those settings for the same reasons we discussed here. They know those children, those settings best. They know if those children are not so good at wearing masks or distancing, and therefore they are applying that more stringent criteria in terms of quarantine and isolation. So I'm not sure if that answers all the questions, but I hope it helps give some insight into some of the distinctions that we're considering when we're looking at these two types of settings.
Yeah, I think that's really helpful, Dr. Sosa. Thank you. And I do think it is important to stress again that Charlene Russell Tucker and I talk at least 3 or 4 times a week. We are trying to align as much as we possibly can on guidance. Okay, Rachel, next question.
Okay, so that covered a lot of the questions around quarantine guidance and contact tracing. And there were some questions around screen and stay. Dr. Sosa has just discussed why screen and stay is not appropriate for childcare settings. I just want to nod to those who have asked that question. So
yeah, and let me just, sorry, Rachel, let me just address. So really, screen and stay is as it was done in November and December is not really being done in that same way at this point, because it's really kind of, I don't know, Tom St. Louis calls it kind of baked into the guidance in the sense of really the focus is for everybody is we need to keep sick people out of school, right? For whatever reason that it is. And so that's really the focus here. And again, for schools in particular, trying to still get kids vaccinated because they are eligible to do so. And unfortunately, right now, that's not an option for these settings, and we're hoping that that will change in the next couple of months.
Great. Thanks, Dr. Sosa. This question may be better answered by you. Who is required to report using this form? All of our licensed programs, family homes, youth camps, because they are required to report to the local health department. So if you wanted to just clarify sort of the use of the form again. Got it.
So from our perspective, any provider that is required to report, and I'm going to let Commissioner Bye explain who those are. I believe those 4 groups are the ones that are required to report that when we showed that form. So reporting on this form meets your requirement for reporting to public health, both us and the local health department. However, if you need guidance, right, or if you are having an outbreak, you should still absolutely contact your local health department. That is what they're there for. What we are saying is that this form meets the requirement for reporting cases, which you are now doing in aggregate as a group, right? For a whole week, you're going to say, this is how many cases I had, as opposed to calling us every single time for each individual person.
Great. So we have some questions. I'm going to switch gears away from guidance, which we've reviewed quite substantially, and talk about mask and test distribution for a second, Commissioner Bye. So I'm just going to pull your video up. So it would be helpful to know for those who picked up a portion for family childcare networks, how we plan to handle pickups in the future, if there's any information that we could offer about future supply distribution.
I will say that the group pickups, we tried to organize that as best we can, but there were certainly some errors. For example, we sent one whole community its full allocation because they wanted to distribute it. And it seems as though some of the family childcare networks didn't get their distribution from that community. So we're trying to, where there were errors like that, figure out. But we literally have every single license number and every allocation. And no family childcare provider should have picked up a part. We picked anytime a family childcare provider came, we gave them their full allocation. And centers picked up a portion on Tuesday and then the balance on Saturday. And if they didn't pick it up on Saturday, the balance remains. So it's almost like you have a bank account of masks and tests for each program. It has gotten complicated where there were group pickups, and we are trying to straighten that out. So every program in the state has an allocation.
And I just want to reiterate on behalf of the agency that there were some distribution challenges around the groupings you mentioned earlier. Sometimes masks came in packs of 20, sometimes in packs of 50. Those were out of our control. So we have definitely provided more masks potentially than are needed. There was a question from one of our listeners today about the instructions for the tests that they don't copy very well. And so we're going to look to have a clean copy on our website. So please look for that in our COVID-19 section of ctoec.org. And one of my colleagues will put a link to that in our question and answer section. So Commissioner Bye, we have had a number of questions, both from providers and there's a few parents listening in today about handling quarantining and tuition with their provider. And so we understand that this is a challenge, and so we have offered guidance at different points when we've been asked this question, but we're wondering if you could just reiterate some of the guidance you could offer to both families and providers around how to handle the question of tuition when there's a quarantine or positive case.
And I will say that we have updated our frequently asked questions, and we have let everyone at OEC who answers the phone know about our response. What we're trying to say to families is that programs have policies about payment when the center closes or when a classroom is closed. You know, this used to be snow days, right? And often those policies say that if the program has to close, that you will still be charged tuition. So we try to explain to families that the written policies are what guides the program rules, and also let families know that programs are working to keep their doors open and pay their staff, and that requires tuition to keep the programs open and to pay staff if they want the staff to be there when the 2 weeks is over or 10 days is over. So I know that programs are really dealing with workforce shortages, and this is making it worse. All the opening and closing and the part-time staff maybe not getting paid, et cetera. So I think programs are doing their best to pay staff, keep the programs open, but parents are paying for a space, and the programs can't control the virus, unfortunately. But we do urge you to, look at your written operating policies and your agreements with parents. And also, I mean, this is so hard for families. It's hard on both sides here because parents then sometimes have to pay someone else to watch their child so they can go to work while they're paying tuition at a program. So I don't know if that answers it fully, but I just want providers to know that, and families, that we have a written response that we've shared it across the agency, and we're trying to help people understand that if we want this industry to stay alive, really, that you can't cut off all the pay because a child in the classroom exposes everyone to COVID. So that's sort of the answer that we're giving.
Thanks, Commissioner.
And I don't know, Deb Fliss, if you want to add in, I think I covered that, or Maggie.
I think you covered it.
Okay.
Thank you.
Yeah.
So we have a number of questions about the reporting form. So this is going to be a tag team between you and Dr. Sosa. The first question is just, the form is required when there are positive cases, but is the form required if there are no cases?
No, it's just taking the place of the usual. You have to report, like we have regulations that say certain communicable diseases you need to report to Department of Public Health, and COVID is one of them. This takes the place of that phone call, really. It's just another way to communicate.
Right. So if in my example, in that yellow period, if there were 0, you don't have to report. I will say, if it's easier for you just to say, I'm going to make sure I fill out this form once a week, even if it's 0, that's fine.
Great. And so that answers to the question around, this is a replacement for if you are reporting to DPH. This is the report to DPH.
Exactly.
To DPH or local health, it takes the place of both.
Correct, exactly. So you do not have to call us. You do not have to call the local health department unless you need guidance or you have specific questions.
And Dr. Sosa, do they need to report about when they heard about the case, the date the case started, symptoms and onset of the positive test? Just
Nope.
the
So,
knowledge of the positive test.
right. So again, trying to make this as easy as possible for everybody, because we all need something to be easy right now, right? So that's why it's basically when you come to work on Monday, you're going to look back at the previous week and say, all right, how many cases last week were reported to me?
Great.
And then that's what you're going to put into that form. And again, the really important thing is only doing that once for that previous week, so we don't double count.
We've a sort of a follow-up question. It's like everyone's scripted exactly. What if someone reports a case during the prior week, reiterating there's an opportunity to resubmit, send an email to you. The communication is in the form saying that this was old data, not the current data that you're submitting. Great.
Yeah.
For programs that operate for organizations that operate multiple programs, so a dozen, 2 dozen licensed programs, is that form required for each licensed program?
The way it's set up now, yes.
Okay. And then if a child has not been attending but tests positive, is that something that should be included in data?
Yes, I think that's the easiest way to do it.
Finally, family providers, are they expected to report cases in family members in their household or household members?
No,
they're not. Okay, they're not expected to report household.
Not to this site. No, they would not have to do that.
Okay. So there's been a number of questions about just best practices or sort of health questions. So it's helpful to have you, Dr. Sosa, to answer some of these. If you have been vaccinated and not boosted, but contract COVID in the interim, what is the current recommendation about when you can receive your booster?
So there's no, this applies to whether you're vaccinated or not. So once you have, you're well enough to come out of isolation, you can technically get your vaccine right away. I would encourage people to talk to their healthcare provider. The only exception is if somebody got a special treatment, for example, monoclonal antibodies or something like that. And in that case, then the period is, I believe, is 3 months. But in the absence of that, and at this point, most people in that situation would be pretty ill. If you're just at home and you come out of isolation at 5 days, you could actually get the vaccine the next day.
Okay, that's really helpful. How would you recommend? There's a question about reusing N95 masks or rotating them. Is there any advice about sort of the use of N95 masks for protection while at work and sort of the lifespan of that supply?
So I'm going to try to channel Tom St. Louis here, and because the N95s in this situation are being used as source control masks, it's kind of the same idea, right? So the other masks, as long as they are, still working well, fitting well, and not soiled and things like that, you can reuse them.
Great. Thank you so much, Dr. Sosa. I'm just going to switch the video for a second. Commissioner Bye, we have addressed many of the questions today. We have received many questions and appreciate your both your positive feedback, some of the support, and your critical questions. And we always take the information that we receive from providers and funnel it into our frequently asked questions, which we post on our website. So if your question was not addressed directly in the course of this conversation, just know that you can always contact your licensing specialist or the agency directly, often Commissioner Bye directly, to ask that question, and we're happy to continue to provide support. So with that, Commissioner Bye, I believe we have addressed all the questions.
Okay. Well, thanks for the Q&A and thank you for the feedback, everyone. I hope this has been helpful. I think I just want to re-emphasize that when there are changes in CDC guidance, it does take us some time to update the current guidance and provide you clear information. And I think this webinar is a really good example of us updating a memo a week and a half ago and the field saying we need more information, So we went back to work with DPH and came up with what we hope is clearer guidance, but we know we can always do better. So we really appreciate your feedback, and it helps guide our work. And I think the only thing certain in this pandemic is change. And that's hard because it's a time of extreme stress as it is. I don't think it's been harder than it's been the past 2 weeks. And I talked to hundreds of you on Saturday and am blown away by your resilience, but I think we're all feeling a little tapped out of resilience. So I hope that you're taking a long weekend and you get some rest this weekend, and we will keep you updated as best we can, and appreciate all you're doing. So have a great afternoon and weekend, and thanks for joining us.